Hi, good afternoon, everyone. Thank you for joining us in person, and for those that are at home, thank you for joining us at home as well. I am not Spring Cooper. Spring Cooper is our department chair. This is the Chaz-sponsored Grand Rounds today, but I volunteered to introduce our speaker today for reasons that will become apparent very soon. It is my pleasure to introduce Dr. Alex Piquero. Let me give you some background on his many accomplishments. This will take me a minute, so hold on. And the print is fine, so we'll see how well my eyes will do for it. We have the pleasure of having Alex today to present. Alex is a professor in the Department of Sociology and Criminology and Arts and Sciences, a distinguished scholar at the University of Miami, and previously served as the director of the Bureau of Justice and Statistics, one of the nation's 13 federal statistical agencies, and he was appointed by President Biden in 2022. During his directorship of the BJS, he oversaw a budget of over $90 million, including several dozen data collections on various crime and justice topics, including police-citizen contacts, and worked hand in hand with a dedicated team of over 50 persons. He started several new data collections, initiated new public health, new publication mediums, engaged in several interagency collaborations, elevated and promoted exceptionally qualified women and persons of color to leadership positions, spoke at the White House on important Hispanic educational excellence, and co-wrote a report to President Biden on criminal justice and policy statistics about the importance of disaggregated data. As the first Hispanic to lead the BJS, he also championed the importance of diversity in federal statistical systems, as well as necessary funding and support for two science agencies within the Office of Justice Programs and the Department of Justice, the Bureau of Justice Statistics and the National Institute for Justice, to better inform crime and justice policy. Sorry, that was one sentence. Forgive me. Prior to joining the University of Miami in 2020, he was an Ashbel Smith Professor of Criminology at the University of Texas, Dallas, where he served as the Associate Dean for Graduate Programs and the School of Economic, Political, and Policy Science, and the Director of Social Impact in the Office of Research. He's also served on the faculties of Monash University, Florida State University, the University of Maryland, John Jay College of Criminal Justice here at CUNY, woohoo. The University of Florida, Northeastern University, and Temple University. He served as co-editor of the Journal of Quantitative Criminology between 2008 and 13, and Justice Evaluation Journal from 18 to 22. He has published over 550 peer-reviewed articles in the areas of criminal careers, race, immigration, and crime, domestic violence, crime prevention, criminological theory, and quantitative research methods. He's co-authored several books, including Key Issues in Criminal Career Research, New Analyses from Cambridge, Study in Delinquent Development, from Cambridge University Press, The Handbook of Quantitative Criminology by Springer, out of Springer, and Developmental Criminology and Crime Drop, a comparative analysis of criminal careers in 2 birth cohorts, also from Cambridge. His work has been cited over 60,000 times with an H-index of 135. A 2019 PLOS Biology identified him as among the top 100,000 most cited scientists in the world. In 2019, 2020, 21, and 22, he was recognized by the Web of Science Group as one of the most influential researchers. He has served as the executive counselor with the American Society of Criminology, a member of the National Academy of Science panel evaluating the National Institute for Justice, a member of the National Academy of Sciences panel on prioritized plan for implementing a developmental approach in juvenile justice, a member of the National Academy of Science panel on modernizing the nation's crime statistics, a member of the National Academy of Sciences Committee on Cybercrime Classification and Measurement, the steering committee member of the National Academy of Science panel on approaches for assessing communicating quality of national statistics, a board member of the Committee on Law and Justice from the National Academy of Sciences, a member of the Racial Democracy, Crime, and Justice Network at Ohio State University, and a member of the MacArthur Foundation's Research Network on Adolescent Development and Juvenile Justice. He's given congressional testimony on evidence-based crime prevention practices in the area of early family parent training programs, and has provided counsel and support to several local, state, national, and international criminal justice agencies, including various police and correctional agencies. In 2015, Attorney General Eric Holder appointed him to the Office of Justice Programs Science Advisory Board. In 2019, Dallas Mayor Eric Johnson appointed him to the Mayor's Task Force on Safe Communities, and Dallas County District Attorney John Crusoe, apologies if I'm butchering the name, appointed him as a member of the DA's Urban Crime Initiative. In December of 2020, the Miami-Dade State Attorney Catherine Rundle appointed him to the Executive Committee of Continuing Justice Reform Commission. In 2021, he was elected to the Council of Criminal Justice. Professor Piquero is a past recipient of the American Society of Criminology's Young Scholar back in 2002, Email Mentor of the Year back in 2005, Fellow of both the American Society of Criminology and the Academy of Criminal Justice Sciences, recipient of the Western Society of Criminology's President Award back in 2017, recipient of the Academy of Criminal Justice Science Bruce Smith Award in 2019, recipient of the Lifetime Achievement Award from the Division of Development and Life Course Criminology of the American Society of Criminology, and he also received numerous teaching awards, including the University of Florida's Teacher of the Year Award, the University of Maryland's Top TERP Teaching Award, the University of Texas Regents Outstanding Teaching Award, as well as the University of Texas at Dallas Diversity Award. In 2018, he was named the University of Texas System's Academy of Distinguished Teachers. His research, opinion pieces, and commentary have been featured in the New York Times, Reuters, CNN, the LA Times, the New Yorker, the Wall Street Journal, USA Today, Miami Herald, Huffington Post, The Atlantic, the Dallas Morning News, NBC News Latino profiled him via an exclusive interview with the Washington Post syndicated columnist Esther Cepeda. So the reason that I wanted to introduce Alex specifically is, in addition to all of that, Alex, when we had lunch, you mentioned that you've been doing this for 30 years. 22 years ago, Alex was my crim theory professor when I was a graduate student, and I was really inspired by his teaching and presentation style. He motivated me for my very first publication, which was published the following year. And so with that, it's a huge honor to have you speak today, and I look forward. And now someone will help me to transition the PowerPoint slide, but thank you. Please give Alex a very warm welcome.
All right, great. Thank you very much, Christian, for that. It's really cool to be introduced by a student who you had a small part in being along their pathway to success and instrumental, slightly instrumental in your first publication. So it's great to be here in New York City at CUNY on a somewhat cloudy day. But it's all good. Thank you all for making the time at the end of a day for many of you all when you have many competing interests. But thank you for choosing this airline this afternoon. As you all know, when academics get asked to come up with a title for a talk, months ahead of time, it's the first thing that comes to your head, and then this is what we're going to do. And what I wanted to do was get at how I got to studying public health as a criminologist, tracing back how I got to that point. I think that's important because all of us as academics, we have journeys that are full of both agency and serendipity, that along the way, things happen to us professionally or personally that influence how we get into certain directions. And so I thought I'd give you a little bit of that journey to show you where I'm at this point in my career. Apologies for the green, orange, and white background, but that's University of Miami colors. This worked a lot 10 minutes ago. I just did. This literally was working 10 minutes ago. In real time. Yeah. It literally was working like 20 minutes ago. All right, there we go. About where I came from. It's important to know who I am. I'm a very open person. My mom and dad came to this country as teenage political refugees from Havana, Cuba. They were dating in high school in the 1960s, and their world changed. My mom went to Miami and then to DC. My dad actually first came to Harlem in New York City as a 17-year-old kid from Cuba. And so I grew up also with my mom's parents in a household where I learned the Cuban version of Spanish, for those of you who are in the room or at home. So I have that real strong background, and everything that's good in my life or anything I've been able to become comes from their sacrifices. My dad was on his way to being a professional baseball player until his dream got derailed. And that's my mom in her garden back in Cuba. She looks as beautiful now as she did back then. But as I said, everything that I've been able to accomplish would no doubt be due to their unending sacrifices. So a little bit about me as a person. On the right-hand side, that's my wife. That's the other Dr. Piquero, I should say, interim dean of the graduate school, Dr. Piquero at the University of Miami. She's also a marathoner. This was the marathon she ran in Pittsburgh, her hometown. That me in the bottom there is teaching in front of class. I'm usually never tethered to a microphone. I'm always around a classroom, moving around, because that's just my engagement in the classroom. And that's myself at a Formula One race in Italy. I'm a huge Formula One race fan, well before the Netflix series got very popular. And one more thing here to show you. I also played in rock bands growing up as a kid. And this is a very famous criminologist named Larry Sherman, who actually did a lot of the early research on policing and domestic violence randomized controlled trials. Back in the early 1990s, we played at our annual conference and we raised money for minority scholarships. So I've been interested in this topic for a long period of time, and it's very important to me. We played a lot of rock and roll, Beatles, Stones, so it's really cool seeing your idols drinking and dancing well into the night for a good cause. And so I thought I'd share a little bit about me as a person to get a sense. So what I want to do now is talk about 26 years of research. And I'm going to do this very quickly and then get into the heart of the matter about public health and violence. I was one of the investigators on a very large-scale project that was funded by the MacArthur Foundation, NIJ, CDC, and lots of other organizations called Pathways to Desistance. In that study, which we archived almost immediately for the public to use, we followed 1,354 serious juvenile offenders in Philadelphia and in Phoenix. And we, of course, academics building a battery, we built a battery that was about that big, and we can't do a 5-hour interview. So it trimmed down to about 2.5 hours. And we track these kids every 6 months on their victimization, their offending. We published papers on mortality, published papers on health and intersections and interactions with the justice system. That data set is one of the most downloaded data sets on ICPSR. It's been used for lots of dissertations and theses. And that research was actually cited in several different Supreme Court cases that upended several draconian juvenile justice policies. So it's really great when you sit at the US Airways Club, the Philadelphia airport, designing a battery that actually becomes a study that actually helps to change policy and lift kids up in the system. I also led a seminal piece of work on juvenile fines. Some of you all may not be familiar with the fact that a lot of the criminal justice agencies in the United States will punish a juvenile offender by making them pay their fines or fees. Our story made above the fold in the New York Times. Hopefully people in the room are old enough to know what above the fold means. I lose my students when I say above the fold. But it made above the fold in the New York Times because our research showed that when you give kids adverse fines and fees, and in our study in Allegheny County, which is Pittsburgh, those fees were higher for African-American youth than they were for white youth. They had higher likelihood chances of recidivating. Made the front cover of the New York Times, it hit Reuters, it hit lots of everybody. And actually that study has been used to change policies to eliminate fines and fees in a lot of different counties in the United States. So that's also a really important part of how I got to where I am. I've also given testimony on the importance of early family and parent training programs. You all are very familiar with these types of programs. You're familiar with David Olds' nurse home visitation program, for example. Those kinds of studies, we did one of the largest meta-analysis on that topic, subject of congressional testimony. We fought for and lost, trying to get that implemented in as many jurisdictions as possible in the US. It is in lots of jurisdictions, but it's much more common in Europe and in Canada and lots of other places. And the argument we've made is very, very simple. You're not just investing in these kids, you're investing in society, because if you give these kids these kinds of tools when they're 3, 4, 5 years old, then you have better outcomes in health, less delinquency and drug use, less promiscuous sex, better education outcomes, and less crime. Seems like a no-brainer to do if people are interested and have the political will and resources to do it. I was also part of Mayor Eric Johnson's task force in Dallas. So when I was in Dallas, Dallas experienced a rash of high homicides in 2018, 2019. So the mayor did what lots of mayors do. They put together a task force. It wasn't a blue ribbon one, so don't worry. We did come up with a very nice glossy PDF, so don't worry about that. But what we did is he tasked us with saying, what are the non-police interventions that might be helpful to work side by side with police interventions? And so we looked at the literature, and I was the only academic on this panel, and the research showed that you can do 4 things. You can do cognitive behavioral therapy. That works really well. You can do simple things like street lighting. You can do simple things like social skills development, and you can do simple things like educational and health nutrition for kids when they're growing up. Those kinds of strategies he got funding for, and then COVID hit. And then everything, as you all know, basically went on the shelf for a year or two. But now they've implemented those strategies. They've gotten funded for them. They've been evaluating. And Dallas now is seeing drops in homicides as a result of those implementations. I then moved to Miami right in the pandemic. So my wife and I were interviewing at the University of Miami in February of 2020. We were hired. We moved in July. It's a wonderful time to buy a house and sell a house, by the way. And when we got there, it was an election day of November 2020. And I walked up to the woman who actually ended up being elected the mayor of Miami-Dade County, which is a county of about 2.5 million people. And I walked up to her and I said, hi, I just came from Dallas. I helped the mayor advise on his crime policy plan. If you ever need anything, I'm your guy. And so it was fortuitous, because you're going to see why she ended up talking to me. I also worked on something, Council on Criminal Justice is a nonpartisan think tank that actually does evaluation and policy relevant work on issues that transcend crime, guns, violence, and all those kinds of things. Our work that we led at the beginning of the pandemic summarized the increase in domestic violence that occurred during the first few months of pandemic lockdowns. My research team and I were the first researchers to document that in the city of Dallas. And then it was replicated in many other cities using hospital records, ER visits, using police data, using all kinds of data. No matter how you looked at it, the pandemic exercised an adverse effect on people's relationships. And then, even less understood still today, is the impact of the kids who witnessed that violence that people are now starting to track. And it's not just physical violence. We saw an uptick in physical violence. Imagine the amount of emotional violence that also took place during that pandemic. When that research came out, it hit CNN, it hit Fox, it hit People magazine. As I always say to my students, you're talking to different audiences using that same science appearing in different forms, and that's always a good thing. There's also part about something called a violent crime working group. We put together a document called 10 Steps Cities Can Take to Reduce Violence. In that, it had a huge public health component. In that, it had a huge non-police officer component. It also had a police department component. The idea was that you have to have these 10 steps, but you also needed to have mayors, public defenders, state attorneys, all putting their egos aside and saying, we are focused on public safety, number one. That effort has now been used in St. Louis. It's been used in Baltimore. It's used in Detroit. It's been used in Boston. These kinds of efforts, if you have concerted, consistent resource staffing and a commitment from the top down, this stuff can save lives. And we're seeing that happen now in lots of cities in the United States. Finally, I was appointed by the President of the United States, the former President of the United States, Joe Biden, to be the Director of the Bureau of Justice Statistics. It's one of 13 federal statistical agencies. All of you know the census and the labor stats. We were in charge of crime and justice data. That was, you can imagine, an honor of a lifetime to get a call from the President of the United States to serve as the Director of BJS and actually walk into a situation like that where you actually can move the needle. We started new data collection programs, one of those on maternal health of women incarcerated, something that we know nothing about, but seems like a very important thing to do. We also started data collections on police officer suicide. Again, I was trying to blend in a lot of the public health stuff into what criminologists used to think about crime and justice matters. We also started collaborations doing joint products with the CDC on mutual topics of interest. And so I've always seen myself as a person interested in crime from whatever lens I can study the issue of crime. Crime historically hasn't been owned by one discipline, but some disciplines think about crime from only their perspective. And I think if we look at it from an economist perspective, public health perspective, a psychologist perspective, that's when we understand the full nature of the issue. So that's a quick background of me as a person, my overall career. And there's that Dallas Mayor's Task Force about philanthropic community. You know about that. Now to get to the mayor of Miami-Dade County. So we had a shooting in May of 2021 at El Mula Light Club. And so in 7 seconds, 100 bullets fired. So think about 7 seconds, 100 bullets fired, 3 kids died. Many more got injured. Well, I testified to the Miami-Dade Council. And for those of you who've testified to a council or a city council, there's a timer on your screen. I waited 7 seconds on purpose. And then I began when the clock was at now 8 seconds. And I said to the council, that's how long it took for 100 bullets to spray. And that was, in my mind, a really powerful way to make a statement about the impact and how quickly lives can change in a spray of bullets. The mayor convened a group of people. I was the academic on that. We wrote a document that was put forth, and she came up with something called the Peace and Prosperity Plan. Sounds so much better than a crime and safety plan. Think about peace and prosperity. Just the words of that convey something to the community. That effort was a public safety program that integrated public health. It integrated the education system. It included parks and recreation. It included the police department. It included the environmental agencies. All of those people met weekly to talk about what are we going to do in Miami-Dade County to make sure we do everything we can do to not let that happen again. So we were fortunate enough at that time, there was a Bitcoin company at that time called FTX, who actually helped fund the program and the development of an evaluation component. And in the first 6 to 12 months, we saw drops in the areas in which these efforts were put in for reductions in shootings by kids and reduction in homicides by kids as well. So it was really nice to have mayors in those 2 cities that I worked in who actually sought out people who knew what the science was and weren't afraid to do things that may be against a political orientation they have or what some of their constituents wanted to do, and were willing to then be evaluated. All of those things are the exception and not the norm, I think, in many of our communities in the United States. But that was, it's really great when you have those kinds of partners at that level. This is a press conference that occurred the day after the shooting. That's me. Fortunately, I'm in a different shirt. I got a call that morning to attend the press conference. And the police chief was there, mayor's there, public defender was there, and they asked me to attend. I'm like, anytime a political official says, hey, can you come and be supportive of what we're trying to do here? I'm always going to do something like that. I think it's important for academics to work hand in hand with the agencies that staff their communities. The person here, that guy lost his son the night before. He ran up to the mayor that day. I'm watching this in real time. She gave him a hug. That shows you the empathy that a leader can have, but it also shows you the trauma that a family member had. And I say this all of my time to my students, and to people, who take qualitative research methods, who are in a class right now. There are people behind those rows in an Excel file. Every one of those rows and columns are human beings, and they all have families, they all have friends, they all have stories. And that day is ingrained in my mind about the impact that we have as scholars and researchers, that yeah, it's great to write articles. Yeah, it's great to be cited, but it's equally as important to do everything we can do to improve the human condition. That's something we owe the community in which we work and we operate. So our working group on saving lives, I talked a little bit about. On that panel, we had academics, we had practitioners, we had policymakers. And I think it's important as well that when we do this kind of work, it's not just the usual suspects, the academics in the room talking to the academics. I remember testifying once on Capitol Hill, and a senator who I won't name told me, he goes, Alex, if it doesn't have a staple or a paperclip, no one in DC is going to read it. And I learned very early in my career that we can do all of the cool research we do and all of the fancy models that we do, but if we don't also translate that in a way to people can understand and then use in the limited hours and seconds that they have in their day, our work is not going to have the kind of impact that we hope it can have. And fortunately, as I told you earlier, we've been able to do just that with this report. And this is, the course, the domestic violence one, which is really cool about this one from a policy perspective. It actually was referred to in several White House statements on funding bills under the previous administration, where they wanted to draw attention to the problem of domestic violence in general, but especially to what occurred during COVID, not just in the United States. We've published research on domestic violence increases during COVID in Guatemala and other cities, other countries around the world. So that's my dog. That's Ari. And the reason why I show this is there's actually a legitimate reason. This is a serious talk. This is the University of Miami campus. This is where I walk. My wife and I walk. It's beautiful. This is where we walk Ari every day in the afternoon. During the COVID time period, the domestic violence report I talked to you about, I did a webinar. And you all remember doing Zoom webinars, right? It's 300 boxes on the screen. Everybody has a dress shirt from the top and sweatpants or shorts, sitting down. Y'all did it, don't worry. And so during that webinar, I talked about our domestic violence research. And I got an email that right after says, would you please be interested in talking to some people tonight at 5:30 about your work? I'm like, which academic doesn't want to talk to someone about their research, right? Sure. So that call was, the President of the United States would be interested in knowing if you would be interested in serving as the director of the Bureau of Justice Statistics. I took that call at the lake. My wife is walking next to me, and I'm like, I had this look on my face. I'm mouthing. She's like, what? Can't read lips. But the 16-year-old Alex, who was a baseball pitcher as a kid, never thought I would have the ability to be presidentially appointed by a president of the United States. But I showed you that not just to have a little interlude, because you'll remember my dog and the campus, but literally, you never know how your career will end up. And the things that you do happen to have an audience, and someone in that audience sees something, and then your life literally changes. And so I wanted to actually talk about that for a second. Okay, so now what you really care about. I am mostly concerned about gun violence. Gun violence is an American problem. It's not an England problem. It's not an Australian problem. It's not a Sweden problem. It's an American problem. And it's an American problem that disproportionately affects certain people in certain communities. The problem we have in America with the issue of gun violence, independent of that, is the data infrastructure on gun violence. And let me tell you why. And then I'll show you a couple of brand new studies that we just published in JAMA to document this. In the United States, we have two main crime data collections. The first one is called NIBRS. It's a National Incident-Based Reporting System that's run by the FBI. Every fall, the FBI releases crime data from the previous calendar year. Gun violence is not a separate category. So if you go to the FBI's data page and say, how much gun violence in there? The answer is, you don't know, Dean. You don't know. That's a problem. The second one is called the National Crime Victimization Survey that's run out of BJS, the agency I used to run. That is a data collection of over 200,000 persons in over 100,000 households throughout the United States that measure the victimization experiences of people 12 years of age and older. It asks about a series of different victimizations, but not homicide. So you only get a small swath of victimization data. Then you have data from the Gun Violence Archive, which I will show you in a little while. The Gun Violence Archive is an independent group that actually does scraping to get data on gun violence. They scrape police department websites, they scrape media accounts to put together as much of an information we have on gun violence, fatal and non-fatal. There are many more non-fatal shootings in America than there are fatal shootings. All right, we only know that because of them. Lastly, we have the CDC, which in my mind has the best mortality data, as you know, a little bit lagged because they have provisional data for months and years, maybe a year or two backwards, but they don't have non-fatal data. Fortunately, what the CDC is rolling out, and we had a small hand in this, is a new data dashboard that maps data on deaths from drug overdoses, suicide, and homicide down to census tracts. That had never been done up until about 2 months ago. That's a huge, huge descriptive, powerful tool because you can look at a census tract, pick your census tract where you live now or where you grew up, and you can actually see that stuff that's going on. Some of that will be provisional because CDC does provisional data like a lot of other federal agencies, but that's huge. We're still not where we need to be. So right now, I cannot tell you how much gun violence there is in America. I can tell you where every plane is in America. I can tell you right now when it took off, what time it's landing, what its altitude is at, right? We all use Flight Tracker or whatever company you use, right? But I can't tell you basic information on gun crime. That's not just a public health problem. That's an American problem that we need to solve right now. Okay. There is a blueprint for this though. NORC, for those of you familiar from them, I'm sure with NORC, NORC released a report called A Blueprint for a U.S. Firearms Data Infrastructure. Basically, laid out a bunch of steps to be focused on improving this data collection. I'm actually part of a firearms data infrastructure group we're doing something similar to this. We actually helped a convening in the White House about 4 months ago, where we talked about what kinds of needs we would need the federal government to do with respect to better gun violence data, especially from a public health perspective. The dean of the Yale School of Public Health was at that conference, as well as several other public health deans and scholars from around the country who were laser focused on the gun violence issue. But primarily, we need the data to better inform the policy. Okay, and I'll talk about that in a few seconds as well. This is data from the Gun Violence Archive. I'm a very big fan of descriptive data. I just like to look at a picture and see what the trend looks like. This is data from the Gun Violence Archive. Now remember, Gun Violence Archive scrapes data. So this is not the population, okay? The orange line is injuries and the blue line are deaths. And of course, you know about the COVID spike. 2020 and 21, the United States saw at the national level a double-digit increase in gun violence. Other countries, by the way, not, but we did. But we didn't see it in every city. And I'll show you a little bit about that in a second. But I just want to put some first principles together. And then you can see we've seen this now ebb decline into 23, 24, and already into the first few months of 25. So we're getting to where we were about a year or two before the pandemic. All right, that's where we are in terms of fatal and non-fatal gun injuries and gun deaths. So let me talk about this paper. This one was released. Yep. No, correct. All right, so this paper I wrote with the guy at NORC named John Roman. We were interested in demographic differences in homicide. We were interested in before COVID and then after COVID, because we know that something uniquely happened in February 2020, or a little bit before that through the end of that calendar year. But we also wanted to look at race, ethnic, and age differences. And fortunately, the CDC's Wonder data set, after you spend the time to learn the Wonder data set, actually provides you really, really good information. So the analyses I'm going to present now, this paper was published last year, are both interesting and disturbing at the same time from both a scientific perspective, but also then from like a human being perspective. So let me get right to the main chart. These are firearm homicide rates per 100,000. Now, you can have the slides and you can read the article. You can download it for free because it's open access. You have whites, the white rates, and this is by years. The white rate is almost not even 5 or 6 per 100,000. The Hispanic rate, a little bit double than that. The Black non-Hispanic rate, much, much higher. In fact, in one of the years, the 20 to 24-year-old age group is 80. 80 to 100,000 compared here to about 5. Now, this next chart illuminates this very disturbing statistic even more. Right here in the year 2021, for those aged 15 to 19, the rate for Blacks compared to whites was 27 times higher. So for every one white kid who dies from firearm homicide, there are 27 Black kids. That's a real big problem. It's not just a public health problem. It's an American problem that needs attention. And it's not just about why is this happening, is why haven't we done something about this? Where are we going wrong? And where do we need to do better? It's the first time that statistic's ever been published in that manner. It got a lot of media attention. Whether or not that translates in anything, very, very hard to say. Literally a month ago, we published this paper, also in JAMA Network Open, on gun violence trends by cities. Remember the aggregate rate I showed you a few slides ago was the national level. And during COVID, Miami, where I am, we saw a slight increase in homicide, but nowhere near the size that other cities did. Miami's about the same size as Philly, Baltimore, New Orleans. They saw real big increases in homicide. You all did in New York City as well, in terms of shootings, fatal and non-fatal shootings. But not every city did. And this is something that's really important from a simple descriptive perspective is we have a national number. And right, the national number is great, but for my mom living outside of Orlando, she could care less about the national number. She wants to know what's going on in her community, right? And your brother or relative in Kansas City wants to know, well, that's nice that we're going to national level. What's happening in Kansas City or in Philadelphia? Just the 2 Super Bowl teams, just thought I'd throw it out there. So we thought, let's dissect this. Let's see what variation there is. Now, we used a very cool methodological technique, not been permeated that much in your discipline, but I think it has huge ability to do so. There's a methodology called the group-based trajectory methodology. What it does is it takes your sample and it basically isolates unique variation in subgroups. So if I were to take everybody in this room and I were to ask everybody in this room, how many crimes have you committed in your career? Don't raise your hand. Please don't do that. And if someone says, let's say 3 people say 0, the zeros go in one group. Let's say 5 people say 1, the 1s will go in one group. Some people say 10, they go in another group. Some people say 25, they go in another group. So what this does is it takes all of those data points and it creates subgroups based on patterns of the data. So people who are 0 and 1 might be grouped together because they look better or more consistently than the people who have 5 or 6, than the people who have 12 or 19. So this model has been used now in 560 studies across a range of social science disciplines that study trends over time that you can count. So then you can see variation and then group those variations and see how they might differ. We apply that methodology to gun violence trends in the 90 largest cities in the US over time. Now you're going to see the results of that output. This right here is the COVID line. That's kind of like when the world shut down, March 15th, 2020. Never forget that. I was supposed to fly to Australia 2 days later. These are the groups, right? there are certain cities in those groups. So this is the gun violence victimization rate from 2016 to 2025 for those two cities. So those two cities look like themselves more than these other cities. So that's what this model does, is it looks at the data and then I don't do it, it's not done a priori by me, it's done by the model. It basically creates likelihood probabilities of you being in this group compared to this group to this group. Hopefully you can see how that would apply to questions that you might be interested in. Okay, it's very easy to use. So Detroit and St. Louis, look at the drive they had right before COVID. So they were having homicide increases well before the pandemic started. So when everybody said, oh, the pandemic is what led to violence increases, well, maybe at the national level it did when you looked at that nation. But when you unpack that, that's not the story. So something was happening in Detroit and St. Louis before the pandemic. And then it begins a precipitous drop. We can explain the drop a little bit because those two cities started doing a lot of very different programming to deal with the problem. Does it mean cause and effect? No, because you know how difficult it is. We don't have randomized control experiments here. And then you have these cities here, Cleveland, Memphis, and Stockton, California, who were basically flat. And then they've increased after the pandemic. So that pandemic crime increase story doesn't hold for everybody. But no one has ever illuminated it like this because no one has applied this kind of method to see. This method isn't about cause and effect. This method is about what does the data show? And then let's go into the data to see what might be happening in those cities. Boston, for example, Boston's down here. Boston historically has had very little homicide for lots of different kinds of reasons. But we find this to be kind of illuminating to see, well, I don't think the story was the same everywhere. And so I think these two papers in JAMA, as you can see, I'm a very descriptive researcher, show not just the variation that exists in people in terms of being victims of firearm homicide, but it also shows the variability that exists across cities with respect to firearm homicide. What we're doing next, because I'm sure you're probably thinking about this, is, well, Alex, it can't be everywhere in Detroit. And that's right, because homicide isn't randomly distributed in a city. You plot it here in Manhattan, it's not randomly distributed in Manhattan. It's not randomly distributed in Miami, where I'm from. So the next question is, where in Detroit were those increases? Where in Cleveland and Memphis were those increases in those cities, but not other parts of those cities? So now you can dissect. The gun violence archive data, unfortunately, though, doesn't have that exact location. So this is one other problem of our data infrastructure in the United States, is we don't have the kind of necessary detailed information we need to have to just describe the problem as well as we can describe the problem. Now, these projects, some of you may be familiar or not, about a year and a half ago, Vice President Harris and the President of the United States, former President Joe Biden, created the first ever White House Office on Gun Violence Prevention. That office no longer exists, but what that office did was bring together people and programs to figure out what we can do in the nation's streets. It brought in public health, it brought in economics, it brought in criminologists, it brought in lots of people. I was part of a lot of the discussions that they were having weekly. They sought out counsel about what can we do to deal with gun violence. They didn't just go to when there was a horrific school shooting, like in Uvalde, Texas, they were there, or in Buffalo, they were there. But there was also about what can we do going forward to solve this problem? Because it's an American problem. That office, will the work continue? Hard to say. The work was really good, but the work was also focused on not just what we can do in the street, but what can we do on data infrastructure. And so that office is actually instrumental in getting that CDC interactive thing I talked to you about that actually maps overdoses, suicides, and homicides and census tracts. That was a new development. For the CDC to put that together in 1 year's time is, for those of y'all who know work with the CDC, lightning speed. Now, hopefully that work will continue. It remains to be seen. That's when the world shut down. Oh, sorry, it should be over there. Sorry, my bad. All right, going forward. So I think that to study this problem and to solve this problem better, we have to encourage law enforcement agencies to publicize this data. Now, this is why it's important. In the United States of America, we have over 18,000 law enforcement agencies. Data collection is not mandatory for crime data in the United States. The FBI cannot mandate crime data in the United States. It doesn't happen. So we will never have the full picture of robberies in the United States. There are some police departments that actually publicize on their websites fatal and non-fatal shootings. Boston, for example, does that. You can actually find the police district where fatal shootings and non-fatal shootings happen. But not every police department does that. So I would encourage police departments, because they should be transparent to the public, to publicize these data, anonymize, you don't have to see all the level of detail, to provide that information, because not only do researchers need it, the community needs it, but you need that data to help inform the kind of policy to address what might be going on in a certain jurisdiction. Also encouraging real-time publication of this stuff. We live in a time when everybody has the answer in 2 seconds. Right? We have to be ready with that kind of data, and we can qualify it and make it as provisional as possible in real time to the world. I remember sitting on an NAS panel with the then Philadelphia police chief, Chuck Ramsey. And we were talking about RCTs, randomized controlled trials. We all love RCTs. And so sitting there, I'm going through a presentation, he taps me on the shoulder. He has a BlackBerry. This was the BlackBerry time period. He has a BlackBerry, and he taps me on the shoulder. He goes, Alex, I love RCTs. I love them. I just can't wait 5 years for the answer. He goes, because I have robberies and homicides right now. And it really brought to me the point about what he needs and what the scientific community wants, right? And so there's always this tension that we have as scholars about the best science versus what's acceptable enough for the real world, right? Because they're living in the real world. They don't have time, and so it's a tension I have every day of my life, and we all probably have. And also the last one, which we don't do very well in the United States, is integrate public health and criminal justice data. We have, as you all know, I'm preaching the choir because I say this to my own students, we have people studying it from this point of view, people studying it from this point of view. They collect data over here, they collect data over there, and the Excel files don't meet. They just don't meet. And that's a problem in universities, as you all know, but that's a problem in these kinds of data collections as well. So we have to do better at that, because in my mind, crime is a public health issue. So you can't divorce these things from one another. Okay, so my work would not have been possible without all of the people who have helped me. You all may remember Mayor Gabby Giffords. She unfortunately was struck in the head multiple times. She has an entire foundation, and I was honored to speak as a keynote at one of her conferences. Nice little story. She actually has walk-on music. And her walk-on song was Tom Petty's I Won't Back Down, which I thought was really, really cool. I like these stories. So some other people here in the room, just so you know, this woman here, that woman was Denise Ross. She was in charge of an Office of Science and Technology Policy under the previous administration. She was so hell-bent on improving crime and public health data integration. She actually helped catalog data in Katrina in New Orleans when that devastation happened. And that was really important. Over here, that would be Gloria Estefan. She's a Miami alum. She's also a survivor of domestic violence. And she's given talks on the University of Miami campus about the approach that happened, what happened to her, and how she overcame that, and kind of resources she needed from lots of different agencies over time. So you can't, and this is Mayor Eric Johnson of Dallas, you can't do the work that we do without having partners around us in every aspect. You need people across all of the industries, across academia, outside of academia. You can put everything aside that we disagree on, but you have to focus on what we might agree on. And everybody agrees on public safety. Everybody, people disagree on how we do it, but we have to do it. Lastly, I was invited to a really great event at the White House 7 months ago. This right here, that's Greg Jackson. Greg was one of the deputy directors of the White House Office of Gun Violence Prevention. He's from Miami. He's instrumental in the work that they did. This is when they signed another set of EOs about better data collection, better data integration, better of all kinds of things with respect to gun violence prevention. And so that was real big honor to do that. And of course, that was a real huge honor to spend some time with the president at that event and some other events. These people care about gun violence and they put a lot of work into it. A lot of you in the room care about public health and gun violence and put a lot into it. And I hope that the community of scholars, the community of activists, the community of policymakers can focus on this issue. Because I said earlier, you know, I'm working in London. London doesn't have a gun problem. London has a knife problem, but even its knife homicide rate is nowhere near our violence rate in terms of fatal gun violence. It's not a problem anywhere else. And we can't just keep saying, we can't be desensitized. Oh, it was just 5 shootings last night. But that's what it is in the United States right now. That to me is simply unacceptable. And so as I will continue to work my entire life to figure out what I can do to make sure we don't keep doing or seeing those stats every single day. So I just want to say thank you very much for spending a little bit of time. I'm happy to answer as many questions as possible. And like every good academic, if I don't know the answer, I'll just make one up. One of the best scenes of all time.
We have time for questions. So that the audience at home is there as well. So for those, if you have a question, I'll just reiterate the question.
Absolutely.
And I think there might also be a question or two in the chat. We'll get to those later.
Sounds good. All right. Happy to answer. Yeah.
Knowledge about like say you can't really get a handle on non-fatal gun violence, but yet we can on fatal gun violence because death records are mandatory to be reported and it's compiled by the CDC from the state health departments. Just wonder if it's like if you could at least estimate like the full impact based on the fatal impact.
So the question from the audience was, we're really good or better at fatal gun violence data, but not as good about non-fatal gun violence, and how can we get a better handle at that? And so the non-fatal one, the biggest problem is many people get shot, they just don't seek treatment. And so you go to a 24-hour 7 facility or hospital, some people just get treatment on the side. And so there's never a record of that. And sometimes also you don't have documentation at a scene, you just don't have documentation of it on the victim. So we can put bounds or not confidence intervals around them, but I'm worried that the confidence interval is going to be somewhere around here. So the only way in my mind that we get at that data is that police agencies report more of that non-fatal shooting data, and several are, and that helps fill the void. No, there's no mandate. And that's one of the biggest problems with the crime data in the United States. There's no mandate. It's voluntary data collection.
Forgive the biography just a hair. I am 5 minutes from having retired from directing health department's injury and violence prevention program here in New York City for 20 years, and I'm an injury epidemiologist. And there is health sourced injury data that is, I wouldn't call it mandated, but it's claims data that tracks admissions and ED visits through that international classification of disease codes. The challenge is the system is uniformly followed, but each state archives and manages those claims data in their own state purview. So you can get those figures for New York State. New York City, we just posted some online even. They lag, that data lag you talked about. And they also carry with them those data limitations. You know nothing about where the incident occurred. You just know someone was injured with a gun and landed in a New York City hospital.
And that's the thing. There's still a missing data problem. You have a missing data problem because there are people who don't go to the emergency room. And so,
but it's
absolutely.
compare the mortality and the morbidity data to together. The health department's done this a little bit to try to round out the picture.
Yep.
With an admission of whole spirit.
Yeah, and so to add that those points real quick, so you had your hand up independently of that, and we'll make sure we get to that. You know, access to a healthcare facility is what lowers the probability of a homicide, a shooting turning into a homicide. Is that you have access to care, and so the closer you are. So in Boston, there are a lot of medical centers, and Boston's a very small, compact city. So that's why there's many fewer deaths than a lot of other cities. Not that they just have lower, they have lower because they have resources. So do you have a question?
The need for partnerships, joining. How is that so hard to do?
So, yeah, so the question was, why is it hard to create meaningful, lasting partnerships in this space? So I have 2 or 3 thoughts on this. One, mayors come and go. Chiefs come and go. Budgets go up and down. There's a crisis today. Now, next week is a different crisis. So it's never this consistent thing that's going to happen. What I like happened in Miami-Dade, is the mayor created an Office of Neighborhood Safety that's funded, doesn't go away, and staffed. So that will be there when she's gone, unless it's vanished. So you got to have consistency. And when the numbers go down and, oh, yay, let's celebrate, that's exactly not the time to celebrate. That's exactly the time to double down, to make sure that we keep where we're going. So I think those are the headwinds that I think political officials have. It's not that they don't care about the issue. I think no mayor wants to have a resident be killed. That's just not happening. So, but it's that inertia and sustainability over time. And Lily, you know, thank you for the years that have done what you did, but getting 10 people in a room, you know, to come to agreement, you know, okay, what are you going to do? Oh, now I got to do this. Now I got to find people to do this. Now you want me to collect that. So there's a lot of inertia not to add to everybody's increasing workload, but you have to put all that aside. You got to say, here's why we're going to do this, and this is how we're going to do it. In my mind.
In your experience building partnerships, did you find one
So,
to claim?
you know, that's a really good question. When I arrived at Miami during COVID, the first thing I did was introduce myself to the state attorney, the police chiefs, the public defender, and the eventual mayor. And I basically said, you know, I've worked with agencies my whole life. If you ever need something, you ever need advice, just article you read, I'm happy to talk with you. And I've always found that to be personally rewarding for me. But what I saw there was, even though they have different roles in criminal justice, they all care about the same thing. And Dallas has that a little bit. Not every city has that. You know, and mayors are mayors, and, you know, it is what it is. But I think also that mayors talk to one another. And when they see good things happening in some cities, they'll go, what are you doing? And how are you doing that? And I think that can breed success down the road. But again, you know this from working in the city, is there's a different problem today. Next week, there's this problem. Next week, there's this problem. And then stuff gets put to the side. Him, and then I'll get you.
2 things. In the political climate that we are in, I understand perfectly, and I think as well, the importance of honing in at the micro level in data collection. But my fear, having lived in Washington, D.C. for 27 years, is that the victims become stigmatized. And when you're talking about neighborhoods, and when you're talking about streets, and when you're advertising data about homicide on a street in Washington,
Sure.
stigmatizing the population, nobody's thinking beyond the statistic.
Yeah.
Why it is so.
Yeah.
That is a very big danger, and we need to be sensitive to it and mindful of it. We, as researchers, sometimes get too much in our own heads.
Yep.
I've seen that happen, so have you.
Yeah.
The other thing is the very pointed picture of the father of the victim
Yeah.
approaching the mayor of Miami. This man is not going to wait for the next generation of children that have been through Head Start.
Yep.
That is not his anguish. It is not the
Yeah.
crisis. And I have not seen any research because there is now a myriad of interventions. Some of them, Dr. Old studied, very long term.
Mhm.
They start in pregnancy.
Yeah.
Some of them are short term. I have not seen a good scientific analysis of the efficacy of short term versus long term. Short term meaning accompanying the injured to the emergency room
Yeah.
to prevent retaliation. You know
Yeah.
what I'm talking
Yeah,
about.
absolutely.
And if we're going to talk about investment in interventions, we need to compare efficacy. There is such a cacophony of interventions that it is very hard to tell where the buck should be, and at least how the buck should be divided. And that, in my opinion, is the future of intervention.
Yeah.
in your field.
Yeah, so that's a great observation about short-term, medium-term, long-term, where to put the dollars, because you're not, you know, if you're going to increase dollars for this, you're going to take it from this pot. And in a county, there are big three pots of money, and we're not going to print more monopoly money. So I think there are short-term things that, in my mind, when you're thinking about police and non-police strategy is a whole litany of different kinds of things. But policing strategies are short-term things, right? Police can do directed patrols and hotspots of crime. That's what they're really good at. And those results you see right away because they're instantaneous. Community violence interruption that the previous administration put in hundreds of millions of dollars a year, where you're taking at-risk youth and you're having caseworkers, former gang members talk to these kids, you know, because you have a 15-year-old kid who might put a gun in his hand tonight. You have a 10-year-old kid who might do it in 2 years, and you have a 3-year-old kid who might do it in 10. Each of those people need different kinds of prevention and intervention. And I think that that's not easy for policymakers and practitioners to understand, because their money isn't 10 years from now, right? And their results are right now. So there are all these headwinds about what you're saying, is that where do we put the money? And a lot of them want to put the money in right now. But I think at least what I was heartened by what the mayor was doing in Miami was, there are things that we're going to do right now. There are things that we're going to invest in that she'll never see outcome of. But we have to do both, right? We have to be living now, and we have to be living for the future.
You are in a unique position
Correct.
to do the research
Correct.
that can give all of us interested parties
Correct.
direction.
Correct.
We're at the loss.
Yeah. Stay tuned. But your point is really important, because of the speed of information and the speed of which people expect things to be done. And you spent time in Washington, you understand that that doesn't happen that way. Dollars don't happen that way. And it's not just the dollars, Dean. It's getting the adequate staff, training them, resourcing them, all dollars. Yeah, and that's the world's not simple, as you know. But we can't keep saying that to people. We need to deliver results. So, fair point. Yes.
I just want to appreciate your answer to that question. You look for kind of, what can I do now that's going to solve the problem, and we don't put enough detail on it. And I just want to note that it took us generations to dig this hole, and generational investors to dig out of it. We have to find the tolerance for that. So I'll get to my question. So just very practically, you know, that enhanced CDC set,
Mhm.
just, I guess, started a couple of months ago.
Yeah.
Do you still have access?
Mhm.
And do you imagine that
Yeah.
the investments will continue to be made there with the climate here and the pullback from expertise and data and measuring the things that make us politically uncomfortable?
Yeah. When I last checked, it was there. That was last week. That's the last time I accessed that page. You can actually drill down to the census tract. It's remarkable. We've never had that before. It's remarkable. From a descriptive scientific enterprise. I I'm an optimist. And I believe in the power of data and the power of data quality and transparency to make effective decisions. I also believe in the people who work in those agencies, having worked closely with these people. The people in the statistical agencies and the health agencies that I don't know them all, the ones I worked with care deeply and passionately about the accuracy and reliability of statistics. Their political orientations are irrelevant to the data collections. They're about the data. And we need to have.
Saying they cannot hear the question.
Oh, okay. Yeah, okay, that one.
So people can hear.
That question was, are the CDC data dashboard that has the overdoses, suicide, and homicide still available? And the answer was, I think to this point, they still do. They were a few weeks ago. The second question is, what are the headwinds politically about whether or not these data will be collected, communicated to the public? And my answer was, I'm an optimist with respect to data quality and transparency. I'm an optimist about the people who work in the various statistical and health agencies. They care deeply about providing Americans with reliable, credible, timely, and accurate data, regardless of one's orientation. I think those data systems are necessary for us to have basic information of the issues that we face in America, whether it's education data, crime data, labor data, whatever it is. I say that I'm a researcher, but I also access those data for my own interests in over time. And so I think that I'm hopeful. I'm hopeful.
Just a quick pause. We have a hand raised, but
Oh.
this is a webinar and they can't speak. Sorry, Piquero. There may be some questions in the chat. Okay, so do you hear me?
I can hear you.
The first question is if you were aware of any promising approaches to collecting state-level data on gun violence that may bypass some of the issues that we are seeing with national or federal efforts.
So the question was, am I aware of any state-level data collections that might bypass some of the limitations and slowness we have in other collections? So after the White House Office of Gun Violence Prevention was created, more than a dozen states have created their own Office of Gun Violence Prevention. Those offices are leading efforts on exactly just that, to create a data infrastructure that brings in all of those disparate existing data collections into one and then produce them out. That's not, it doesn't like happen like your iOS software updates overnight, because they're government agencies and they're record management systems, and you got to put them all together. That takes time and some money, but that is happening. But the best source of information right now are police agencies that actually have those data and publicize those in real time. That's where we're at right now.
Thank you. And the next question is that everything that you propose moving forward seems very reasonable. Gun violence is a public health problem. What suggestions do you offer on how to mandate this data collection?
So the question was, this all sounds great, but how do you mandate data collection? So I've been a part of several National Academy of Science panels on this topic. I directed a federal statistical agency on this topic. And it's always been an issue about, because the United States does require some data collection mandated, but not crime. And I've always, as a person, I've always believed that if we're not making data required, then we're not having a complete picture of the phenomenon of interest. And if we don't have a complete picture of the phenomenon of interest, then we won't understand it. We can't create effective policies around it. Now, there are states that mandate their own data collection, Tennessee, for example, from law enforcement agencies, and then they report it to the federal government. So that is an intriguing pathway forward. And you have states that do that. And that's a good thing. And that's a model. If Tennessee can do it, every other state can do it. And so there's this always issue about federalism, right? How much can you encroach about data collection? And right now we have 18,000 police agencies. We don't have the same record management system across 18,000 police agencies. The same crime that happens here might be coded differently in another police agency. So you have to crosswalk those definitions. So there are levels of problems here. But if a state can do it internally and you get almost 100% reporting, if we can multiply that out, then we're going to where we're at. We are good. We're not where we have to be. And, you know, I like the population of data. Yes.
Justice agencies and health agencies don't define homicide the same way. So there's some fundamental
Yeah.
challenges
Yeah.
in coming together around what means what.
Yeah.
How to measure that.
Yeah. So the comment in the audience was that criminal justice data and public health data don't always define homicide in the same way. Like one's a legal definition for law enforcement agencies and state statutes, and the other one is IDC codes, right? And so to make a parallel, hate crime in the United States, whatever number you hear of hate crime, don't believe the number. The reason why is there's no mandatory reporting requirement. So some jurisdictions will report zero. Zero? In a big city, it's possible. It's possible it's zero. But a hate crime is legally or statutorily defined differently in one county or state compared to another. So the same crime that occurred in one place may not be the same crime in another place. Moreover, when an officer gets to a scene of a hate crime is denoted by the officer at the scene. If they don't have information, they are coded as missing. Do they go back then and fix that missing data file? All of you know the biggest problem in our lives is missing data. And that is a problem with that as well. So, you know, this is when I think, you know, when people message things to the public, they have to be very good about saying, this is the data we have, and this is the qualifications of the data. I think and that's not to hide things, it's to be transparent to the public. If you're transparent to people, they'll appreciate any forthcoming that there is in a data set. You just got to telling them, this is what the problem is. And maybe that will energize the public to say, well, we need to have better of this. So great observation about the variability across different strands of domains collecting the same piece of information. Yes.
Another question in the chat. What is the impact of gun availability on drug-related crime? And should gun access be regulated to prevent gun-related violence?
So the question was the linkage between gun availability and drug crimes and so on. There's a pretty good consistency with that. I grew up in the DC area, and most of the people in the room remember the crack cocaine era. That was a gun drug era. The drug trade has changed a lot. The type of drug trade has changed a lot. The crack market was very violent. It was very open. It was very in the street territorial. The drug markets today are very different from that. But the correlation between those two kind of follows each other fairly well. Gun availability is a different issue. We have a lot of guns in this country. We're going to have a lot of guns in this country, and whatever mine or anybody else's political view about a gun is, it's going to stay by the wayside because it's here for now. There are other countries where there are a lot of guns too, where they're required. They don't have the gun violence problem we have. So it's availability is lethality, right? A gun is more lethal than a knife, and knife is more lethal than a fist. But you have to still have the gun. So it's not just the presence of something, it's a presence of something in someone's hand who, for whatever reason, decides that's the way to solve a problem. And that you need to address both of those in my view.
Or at-home questions? Is that it for the at-home questions? Yes.
So a very urgent question. Do you believe that there will be funding in the coming years to study issues that you described today? Or is your intuition that there will be a looming crisis?
I think there'll be issues, I mean, I think there'll be funding to study crime and violence broadly defined. That won't go away. Um, Now, how those dollars are appropriated and spent obviously changes from administration to administration. But I do believe that a lot of people who are, in the administration, work throughout the administration, care about this issue. They dealt with this in their own communities. I think that that still will be on the radar screen of a lot of people. Now, every administration has their own priorities. Crime is but one of the many priorities that leaders and administrations face. I do think that crime, broadly defined, is going to be an issue going forward, and that funding will follow that. How much and in what area, we all are going to have to wait and see. But I will, one more thing I think is important to add. Funding for this is not just at the federal level. States can lead on this issue too. Mayors can lead on this issue too. They have options of what to do with several of their budgets. And I've always believed that the federal government's great at giving money to states for states to do things with. So if a state and or its county mayors or its elected leaders care about an issue, they'll deal with it. And so I've always believed that you can tackle this problem of crime at the local level much easier than you can do as you go higher in any level, in any administration, in my view.
Balance public funds compared to private funds dedicated to this form of research.
Yeah.
How do they compare?
So the power of the person, the federal government's hundreds and hundreds and hundreds of millions of dollars. Private philanthropy is nowhere near of the many zeros that go after that. There are some that put a lot of money into this. Arnold Ventures has done a lot of this stuff. Robert Wood Johnson Foundation has done a lot of this stuff. What they're going to be doing going forward and where their priorities are, hard to say. I know that they're very interested in data measurement. And that may not be the most interesting topic for people, but we need to have really good data measurement to measure what's going on at the local level. So that's what I see the private foundations focused on right now. Some of them also, are interested in programming, but they're also interested in infrastructure because we are so bad in a lot of our infrastructure. So that's what I see in the immediate landscape.
Reach between federal criminal justice agency and federal public health agencies on this topic? I'm asking it deliberately this way because I am concerned the public health agencies who have grown in size and shape on this topic are likely to be defunded in this area. But if the justice agencies are still funded, is there reach into the data systems that are going to be tracking it differently, but altogether there would be a more coherent?
Yeah, so the question in the audience is about the coherenceness of different federal agencies that might fund, will have fund, may not fund this issue, this problematic issue of gun violence, broadly defined from their perspective or in concert like they have in the past, something along those lines. I've been fortunate to have funding from multiple agencies in the same time. And that's sometimes you need to bring dollars in for those purposes. One thing I did when I was the BGS director that I hope has legs was I brought in Jim Mercy, who oversaw the violence unit in CDC. And I've known Jim a long time. And I said, we need to work on multiple projects together because we have the same touch points. Now, slightly different way, but we touch the same issue. And so we did start creating that partnership. Whether or not those partnerships stay depends on the people in those seats. And that's true of anything. So if the people in those seats want to continue doing the work, then they will continue doing the work. Look, the NIHs, the NIMHs, the CDCs, they have a mission to the American public to do work that they are legislative authorized to do. There's authorization to do things. We have to hold them accountable to do the work that they're supposed to do. They're supposed to improve the human condition. That's what my optimistic self says, that they're going to continue to do that work. May not be at the size and scope. Hard to say. I don't know. I can't predict the future. But I gotta believe that will be the case.
I noticed that you mentioned there was a collaboration with Bitcoin company.
Yep.
Can you elaborate a little bit more on how that partnership?
Yeah, so in Miami-Dade, the question was, how did the Bitcoin company get involved? And basically, they made a donation of sorts to the county to fund this effort. That's what happened, and it wasn't a few dollars. It was a significant amount of money to basically fund the programming parts of things, and then a small part of it funded the evaluation of it. So, and you know, that's an important public-private partnership, and I think a lot of mayors and county officials sometimes have to look to private agencies and private funding because they have a lot more purse strings. I mean, a mayor's budget's constrained, or a city council is, because you have to pay employment, you have to pay healthcare and education, right? Those the main dollars that go in many public budgets. There's not much more to that, and then you don't want to increase people's taxes, right? So you got all of this are the headwinds that people have in terms of that. So the degrees of freedom in public dollars are not as great as they are in private sector. Private sector has funded a lot of stuff in criminal justice, prevention, intervention, and evaluation. Lots of money has come in that way. I'm not an expert in how much of that private money has gone into public health. Obviously, you all are the experts in that domain. But that's, you know, if I'm a city political official at a county or state, or, you know, representative in one area, I'm doing what I can to raise money to implement the most effective strategies and programs to help all kinds of things. That's their job as political officials. It's their job.
We're close to time. Alex, I want to say thank you so much for flying all the way here, leaving a very warm environment to come to our sunny,
Great to be here.
double-digit 30-degree weather. And thank you so much, Alex.
Thank you. Thank you all very much.